Do you worry about taking a long car trip because you have to pee too often? This video is probably for you. We're going to talk this week about overactive bladder, so stick around. Hey, welcome back. I'm Dr. Bruce Crawford. I hope you've subscribed to this channel already. If not, it's not too late. Hit that subscribe button, hit the notification bell. We want to hear from you. Comments below, please. Today's topic is overactive bladder, just super common. In fact, this problem affects men just as often as it does women. About 40% of adults have this problem, believe it or not. But it's not significant. It's not life-threatening, but it is quality of life threatening. And it is significant. Some have estimated it second only to major depression in terms of its impact on quality of life. That sounds significant to me. Well, you always have to take expensive medications with side effects if you have overactive bladder. Not true. That's a misinformation. Maybe you've gotten from advertisements you've seen on television, those gotta go advertisements. In fact, most patients can control this problem with super conservative measures, the kind of things we talk about on this channel. How to avoid surgery, how to avoid medication, and when you can't, how to proceed safely and intelligently. So overactive bladder is common, but it is treatable. Now, there's some super conservative measures that you should start with, and they're easily accessible. They don't even require a trip to the doctor's office. Having said that, I will remind you all, I am a doctor, but I'm not your doctor. This is not a substitute for health care. It's a disclaimer I probably should make every video. So the problem of overactive bladder should be approached like this. If you're urinating more often than you should, or if you get an experience out of the blue, all of a sudden, that you gotta go and you might not get there quick enough, you worry about that, or maybe sometimes you don't get there quick enough and have leakage of urine, usually larger volumes of urine than one would experience with stress incontinence. That was last week's topic. I hope you watched that video. If you haven't, go to the channel and check it out. But it is the kind of experience that, as you might imagine or perhaps know, is very embarrassing and has the effect over time of causing people to withdraw from a lot of social activities they would otherwise do. If you have this problem and you can't be certain a bathroom will be available where you're going, maybe you'll choose not to go. Or maybe you start traveling with a change of clothes at all times. Or maybe you start restricting the amount of fluid you drink before you go. So all these things have a net impact that can create social withdrawal and depressive symptoms, and certainly worth doing something about, confronting it. But you know, the average duration of time people wait before addressing these kinds of problems is 4.5 years. They'll put up with these symptoms for 4.5 years before they show up in my office to do something about it. And the vast majority, maybe 75%, maybe more, patients with this problem aren't being treated at all. That's incredible. And there's so many things that you can do. And it doesn't just mean taking medication or having a surgical procedure performed. So the first super conservative option is to look at the kind of fluids you're consuming. And a good way to get an idea of what's going on with that is to complete a bladder diary for 3 days. Now, bladder diaries usually include a log of what you're drinking. Now, there's certain things that are very irritating to the bladder, like coffee, tea, alcohol, soda. These things tend to either cause the body to produce more urine in a short time than it otherwise would, or are actually is caustic, irritating to the bladder, making a sensory problem, having to urinate more often than you'd like, even worse. Now, that doesn't mean you have to eliminate them altogether. I know the Midwesterners listening to this will not give up their iced tea. I've lived in the Midwest, and I like iced tea too, but I really don't want to give up my coffee in the morning. So what do you do about that? Well, there's a couple things. One, you can switch to decaf coffee, or you can go online and search for a low acid coffee. That's a product that tastes good, still has caffeine in it, but isn't quite as acidic as the store brands that you may be using right now. And just, taking coffee off the shelf in a store, there's going to be a big difference in how irritating one brand is versus another. So just perhaps experimenting with a couple of different brands and cutting back from 3 cups a day to 1 cup a day, or maybe not drinking it quite so strong, would be worthwhile. Alcohol, we know, has this diuretic effect, making the body produce more urine, makes the problem worse. Definitely should be limited. And soda as well, especially diet soda. Aspartame, a sweetener that's used in a lot of diet sodas, is really noxious to the bladder and just should be skipped altogether. So eliminate that one completely. What else? Well, I'm sure it's not going to surprise you to hear I'm a big advocate of pelvic floor exercise, and pelvic floor exercise is the first-line treatment for overactive bladder and is easy to perform, and if performed reliably, will probably work. Now, the Pilates program, and if you haven't visited our website yet, don't do it right now. Wait till the video's over. But go to www.pilates.com and check it out. This is a program of movement. It's a lot more practicable than the recommendation, go home and do your Kegel exercises. Nobody does them. And Pilates, though, just a few minutes in the morning, a few minutes in the evening, is quite practicable and highly effective. Now, if you get our DVD or if you buy the whole program, you'll see that there's 10 different Pilates movements. You don't have to do them all. Find one movement, maybe 2 movements. Make those your movements. How do you choose? Well, you have to be able to do them. Some are done standing, some are done laying down on a mat, some on your knees, some on all fours. But find ones that you feel that you can do, and then movements also that give you a good sensation of pelvic floor tightening, that central tightening associated with a pelvic floor contraction, the feeling you'd get when you do a Kegel exercise. If you're not sure if you can even do a Kegel exercise, go see your doctor, and while having a pelvic exam, ask them if you're able to activate the pelvic floor while doing a Kegel exercise. And with that information, you'll be all set to pursue a program like the Pilates program. So those are some really conservative measures that don't even require you to go to the doctor that you can try. And if you do, you probably will be successful. So bladder diary, look at what you're consuming. Avoid the things that are caustic, irritating to the bladder, or have diuretic effects. The Pilates program, all ultra-conservative measures that can make a big difference. But what if they don't work? Okay, that is possible. It doesn't work 100% of the time, and it doesn't work for 100% of the people. There are other options available, like medications. Now, you've probably heard about these. I brought some samples, just pulled them off the shelf of the office. So, the drug reps leave these in our office, hoping that we'll hand them out, that patients will like them, be successful with them, and continue them forever. Well, that's certainly not our intention. But in the short term, these medications can be a useful bridge, if you will. But for all of our patients, we try and get them off of these medications with time, if we have to start them at all. So there's a couple different classes of medications you should know about. One are called anticholinergics, like this product called Vesicare and this product called Toviaz are in this anticholinergic class, and they work pretty well. They work by binding a receptor in the bladder that basically makes it harder for the bladder to contract. They do have side effects, dry mouth, constipation. Those are the really common side effects. And, if you're already constipated, you might want to ask about alternative medications, or at least add a stool softener if you're going to start another medication that's constipating. So many people take so many different drugs that all have, or many have, anticholinergic side effects. The cumulative amount of anticholinergic dry mouth side effect can really be a burden. And so for some people, the side effect is worse than the condition that's being treated, and they don't continue these medications long term, and understandably. There's a newer class of medication for overactive bladder called Myrbegron. That's an interesting drug. It actually works on different receptors in the bladder altogether. So while the anticholinergic medications bind receptors associated with the parasympathetic nervous system, the newer drug, Myrbegron, binds a receptor associated with the sympathetic nervous system and doesn't cause dry mouth commonly or constipation commonly. Generally well tolerated, but it is the FDA's recommendation that you have your blood pressure monitored while taking this medication. They don't say specifically when or how often, but it's our practice to see a patient back 2 weeks after they've been on the medication, and then maybe a month or two after that, just to make sure that it's not interfering with their blood pressure. Patients that take metoprolol, which is a fairly common blood pressure medication, might not be offered this drug at all because it kind of competes for the same enzymes in the liver that metabolize these drugs, and it could affect your body's overall exposure to your blood pressure medication and then take an otherwise stable blood pressure and make it less stable. And so that might be something to consider as well. But imagine this. Ultra-conservative measures and conservative measures like medication still aren't working. Now what do? Do I just have to live with it? Well, obviously, no, you don't. There are still more things. And one of the treatments we use a lot at the Center for Pelvic Floor Medicine is called Percutaneous Tibial Nerve Stimulation. PTNS is the way people generally refer to this treatment. And it involves taking a hair-like acupuncture needle, just super tiny, doesn't hurt, and it's inserted just inside the ankle and then stimulated for 30 minutes, 12 sessions over the course of 6 to 12 weeks, and it works pretty good, especially for nighttime voiding. Patients then generally will come back once a month for a maintenance session for a year after that, and Medicare pays for it. And so that's another consideration you can ask your doctor about. If they don't offer this therapy themselves, maybe they can refer you to a urogynecologist or a urologist that does, right? What about Botox? Well, it might surprise you to learn that Botox isn't just for cosmetic applications. It's not just for your face. You can actually inject Botox into the bladder for patients that have overactive bladder that haven't responded to other options, and actually it works pretty well. It can be done in the office. Generally, it has to be repeated, so it works, but over the course of maybe 6, 12, or 18 months, wears off, and so patients will oftentimes and generally need more than one treatment if they're going to use Botox, and it's pretty safe by and large, but one caveat you should keep in mind is that a few patients, not very many, but a few patients that have Botox injected into their bladder won't be able to empty their bladder afterwards. And it may be to the extent that they even need to be catheterized or catheterize themselves several times a day. And if that's just not something that you're physically capable of doing, Botox probably isn't for you. Now, if that just sounds like something you really don't want to do, totally understandable. Who would want to do that? It sounds terrible, and patients that really need to do it are always resistant at first until they learn the skill. It takes a week or two to really kind of get comfortable with it, and then it's no big deal, believe it or not. Probably going to take more to convince you of that than we can accomplish on today's video, but it really is true. And finally, there's a procedure called InterStim, which is effective for patients with overactive bladder that haven't responded to more conservative measures. And InterStim's interesting. It actually involves implantation of an electrode into the sacrum with a little battery pack pacemaker that stimulates the nerves to the pelvic floor and the bladder chronically over time, and it's quite therapeutic and quite successful for most patients that have that procedure done. It's done in 2 stages. First, a little wire generally is placed, and to see if the electrode would work, and if you are successful over a couple of days wearing an external battery pack, your surgeon would take you to the operating room, place the permanent electrode in the battery pack in the fat of the buttock, and then the device is actually programmed with a remote control, believe it or not, and then maintained generally by the physician that placed the device. And so InterStim, geez, that's at least 1 trip to the operating room, super expensive, but in certain circumstances is covered even by Medicare. And what else with InterStim? Can't have an MRI if you have InterStim placed. When there's metal in the body, the radiologists will get excited about that and not let you have an MRI. Something to think about. So what's this week's challenge? How about this? Download a bladder diary. This is no big deal, and you can complete it for 3 days. A little bit of a hassle, but I think you'll find it interesting. And what we've witnessed reliably is that the bladder diary itself has a therapeutic effect. There's something about completing the bladder diary that actually starts to make patients better. I don't know if it's just that you're having your consciousness raised about what your habits are or what you're drinking, but it seems to be beneficial even without doing anything else. Now the target you're looking for in terms of fluid intake, which is recorded on this diary, is 60 to 80 ounces a day. Water is the best thing you can drink, but just don't change any of your practices. Just download the diary and keep track for 3 days and then take a look at it. If you're urinating more often than 7 times in 24 hours, if you're having any accidents, if you're having to wear pads for bladder control at all, that ain't normal. And maybe you can embark upon some of the super conservative options we talked about, or maybe you choose to go talk to your doctor about it. And if you do, I hope you're successful, and I hope this was interesting. Leave some comments so I know what you want to hear about in the future. Next week, maybe we'll talk about, I haven't decided, maybe we'll talk about the Pilates program, or show you what the VESI lab is. That's video EMG synchronization. You can go to VESYLAB.com and learn more about that now if you just can't wait. We got a lot of topics coming up. We're going to talk about prolapse and pessary devices. We're going to talk about urinary tract infection and how to avoid them. We're going to talk about sexual dysfunction, and probably there are things that I haven't thought of that you have. Tell me what they are. Put it in the comments below. I'll see you guys next week. Thanks very much.